Good evening, everyone. I'm Pam Groves Gaggioli, current president of St. John's Women of the ELCA, or WELCA for short. Thank you all for coming out tonight. Please feel free to help yourself to our buffet of coffee and treats provided by Sarah Bright. Thank you, Sarah. As we gather tonight, I'd like to take a moment to read St. John's Land Acknowledgement. St. John's Church stands on the ancestral homelands of the Wapekute Band of the Dakota Nation. We respect and are grateful for the generations of Native people who have cared for this land. There are a few announcements before we get started. There are new WELCA books at the registration table describing WELCA's work here at St. John's and the contacts for our committees and special groups. There are also flyers of the upcoming Courageous Conversations programs. On that table, we also have a free will basket. The funds help support our Courageous Conversations programming and many other outreach programs that the women of St. John's carry out throughout the world. WELCA maintains a fiscal independence from the church. Your donations are welcomed to help keep this wonderful outreach programming going. This Saturday, November 8th, WELCA is sponsoring our mission morning from 9 to 11 a.m. right here in this room. Come have a cup of coffee and a muffin, maybe some fruit, and then help get infant care kits, baby kits, personal care kits, and hospice kits ready, or help tie a quilt or roll bandages. We all have a good time working together for a great cause. And if you're interested to know what goes in all those kits, right outside the door to the left are all the contents of the kits that we send around the world. Courageous Conversations is now in its 8th year. This year's theme is Creating Community for Common Good. The following thoughts shaped this year's program. A quote from Barbara Jordan, former U.S. House Representative, Texas. A nation is formed by the willingness of each of us to share in the responsibility for upholding the common good. And this from 1 Corinthians chapter 12. There should be no division in the body, but its parts should have equal concern for each other. If one part suffers, every part suffers with it. If one part is honored, every part rejoices with it. So, at this moment in time, with deep cuts in support systems funding and demoralizing rhetoric, we are called to create community for common good. We provide a space for finding common ground across differences and forming relationships to create a more just world for future generations. We believe that the shared principles of dignity and human rights are critical to both our faith community and our democracy. Our monthly speakers will enlighten us on local and national implications for education, housing, healthcare, and the environment, along with freedom of expression and equality. I would like to take this opportunity to recognize the members of the WELCA Justice and Education Committee that are responsible for putting together such an impressive slate of speakers this year. Joe Franklin, Don Tomerdahl, Jennifer Edwins, and Margie O'Laughlin. Tonight's program is being recorded for our Courageous Conversations library of speakers, which you can find on the St. John's website. And now I would like to call on Allison Kavanaugh, who will lead us in the invocation, with Rhonda Reese as accompanist and Sarah Bright as our lead vocal.
Good evening. Singing is resistance because it gathers us. A single voice can tremble, but voices joined in song become something unbreakable. To sing of peace, plead for the peace of all creation, pray for a peace where grace is found, is to declare that a different world is possible. It is to place our feet on holy ground and name Shanti, Pax, Shalom, Masala, Maslaha, peace in every tongue, for every people. And tonight as we sing, let us take our place in that long tradition of peaceful defiance, holding fast to the common good and daring to believe in grace.
Thank you, Sarah. Thank you, Rhonda. Thank you, Pam and Allison. And thanks to each one of you for coming out tonight. It's dark out there. By singing together, and as we move into our program, taking the time to turn and talk to one another, we hope we'll become just a little bit more connected for all the reasons Allison mentioned. So please join me in extending a warm welcome to our guests tonight, 3 dedicated change makers working to provide responsive, quality health care in our community. Dr. Amy Ripley will facilitate tonight's conversation. She spent her whole career in family medicine after working at Northfield's Alina Clinic for 19 years. She left to follow her sense of calling to care for the most vulnerable in our community. Dr. Ripley joined the team of healthcare providers at HealthFinders Collaborative in February 2024. She is passionate about whole person care to promote overall wellness for all, regardless of resources or circumstances. Dr. Ripley currently serves as medical director and sees patients part-time working alongside with them to achieve optimal health and wellness through care, education, and advocacy. And Dr. Amy will now introduce our guests.
Thank you, Margie. Is this working? Before I introduce these 2 wonderful people, I was thinking about when I first met Daisy and Charlie. And it was about 2 years ago, almost exactly, that my circumstances of what I was doing in my job were a little bit up in the air, and I happened to go to a soccer game at St. Olaf College, and there was Dr. Rod Christensen, who was my first office mate when I came to Northfield many, many years ago. And I was telling Rod about the situation I was in, and didn't really know what I was going to be up to, but I knew I wanted to do it in community health. And he said, well, you know, maybe you should be going to talk to HealthFinders. And I said, well, Rod, I'm not quite old enough to just be able to retire and volunteer yet. And he said, no, I really think you should go talk to Daisy and Charlie at HealthFinders. And so I did. And boy, not too long after that, I started working there. So it went pretty well when I went to talk to them for the first time. But anyway, Charlie Mandley is the executive director at HealthFinders. He provides the direction and leadership to us there. He grew up in Minnesota. I think his first experience of getting him to Rice County was when he came to be a college student at Carleton, where he studied biology. He later went on to study public health and went around the world to learn about public health in different areas, including in Mexico and Chile. And he is also fluent in Spanish, which really helps a lot in our community that we take care of. Charlie's passionate about engaging communities to know about how to take care of their own health and rethinking what primary care should be, and that it allows it to be better serving the communities that we work in. Daisy oversees and runs everything about the day-to-day operations at HealthFinders. Her responsibilities include about everything that happens under the roof of our building. Prior to coming to HealthFinders, she worked as a manager in adult foster care group homes and served as interpreting for Rice County Social Services and for the city of Faribault. Daisy believes that her biggest reward for working at HealthFinders is being given the opportunity to give. Okay, I don't know if you guys are done talking, but I hear some a little less talking than I did before. But what we'd really like from you guys is if you have some questions that maybe as a group you came up with as you're talking amongst yourselves, things you'd maybe like to know more about when it comes to what we do at HealthFinders or anything else that is maybe adjacent to this conversation. And I think we're going to pass the mic. And I think, Rod, are you still going to do that, or do you want to be running? Okay,
Hi.
Sounds good.
Okay, this is working. All right. We're curious, what hurdles do you anticipate in this climate of higher healthcare rates that are knocking at our door right now? So what are you anticipating, and what is your game plan?
Great question. Well, I'll let Daisy talk a little bit about MNsure assistance. There's a lot of dynamics in MNsure that we see every day, but I guess from an organizational standpoint, our board has asked us to be prepared, basically, that, are thinking a little bit ahead, that if people either are unable to have, the end of the spectrum that we look, that ultimately overlaps with us is the Medicaid or Minnesota Care, as fewer people might be eligible for that, presumably more people will be eligible for our care. And so we have been staffing up just because we need to anyways, but I think those are the kinds of things that we are thinking about. I think our financial model and our plan is sound and is poised to scale as needed. And I think continuing to really look at Alina, Mayo, Northfield Hospital, and clinics as partners. For many, many years, there was this growing movement in healthcare to incentivize them to keep people healthy rather than just pay for MRIs and things. Imagine that. And we were working with them to kind of show them how to do that. That our healthcare system isn't based on paying for those things, but we have the luxury as a nonprofit to do the things that the patients need, not just what we can get paid for. And so we have built these systems that I've talked about social determinants or prenatal care, thinking that at some day the healthcare systems are going to get more and more incentivized to do more of that, and we want to help them do that. Well, now I think the pendulum has swung the other way, and they're going to start knocking on our door to say, help us see these patients, because we can't see them, or it's not viable for us to see them. And so I think a lot of what we've been doing is really set us up well to handle this. I will also say, and a lot of these folks, Mayo and Alina executives are on our board, some of these contingencies are so disruptive and seemingly far-fetched that it's hard to do any real contingency planning on them until they have it. Because if someone came to you and said, well, draw me up a financial model, the Mayo CFO is on our board. He said they asked to draw a financial model for the impact of the Medicaid cuts. And he kind of said, you don't want to see that model. That would be hard to do. So it is truly consequential what's happening right now to the entire healthcare system, and I think we'll just need to fall back on things that I think are already doing well, working together, partnering, and building capacity, moving quickly based on what the community needs us to do. You want to talk about MNsure and how you see the prices affecting people?
Oh, yeah. I think every year Minnesotans brace for this time of year, more so this year, for sure. I mean, we've seen the news and we've seen the announcements about the increases in premiums, and that's going to be really hard. It's a really stressful time for families when they're selecting a plan, and now they have to plan for either 20, 30% increase in their premiums every month, or deductibles going higher. And that's when we see, and we do see that in our clinic, where patients who have coverage but a very high deductible are essentially acting as if they have no coverage, because I mean, nothing covers me for 15 grand, right? So we do get to see that. I think myself, as a certified navigator, one of my favorite jobs to do at HealthFinders, by the way, I see it every year, where families are coming in, November 1st starts rolling around, and they have to pick a plan, but they have to decide what, and I always ask, do you have a budget? Okay, they come with a small budget, and I always say, well, you know, it takes a few visits. It's not just, here's what I want, here's what I need, let's pick that plan and that deductible. It's always going to take a second visit, because they sometimes have to go home and think about, can I really afford that?
This year has been kind of a year of ups and downs for us, at least as providers, because we started this year with our patients being able to participate in the MNsure expansion in Minnesota. So for some of our patients, for the first time, they've been waiting to try to get surgeries they needed, or see providers through our specialists that could provide some of the things that we just can't do at HealthFinders. And then, of course, with the changes and everything, the legislature voted to take that away. And that we will have now a group of our patients that we got them in to get signed up, and were granted to be a part of the MNsure programs that they could pick from. And now, at the end of this year, anyone over 18, they will be kicked off of that. And so, even if nothing else changed, we'd be seeing those folks coming back to us needing our services again. But I think we'll also see a group of folks who are no longer going to qualify for Medicaid through the state and be without insurance. So we'll have more people that need to come to us with not a lot of more spaces to let them come to, at least for the provider visits. So we'll be all kicking in to try to make up for that in whatever way we can.
So I think it's becoming a little more clear to me, but kind of our general base question is, like, who qualifies to get help from you? Because I think at this moment, at this table, we all want to come. Because the continuum of care and that community surround sounds so fantastic. But maybe you can just help us. I know nothing about HealthFinders. I'm relatively new to Northfield and the area, so for me this is all new and exciting, and maybe just a little more baseline would be helpful. Thanks.
Yeah, we'd be happy to discuss that. So our service area are really, the main point are the three cities that we serve, which is Northfield, Faribault, and Owatonna, and those counties combine, all their townships that are surrounding. Typically, patients who see us are uninsured, so they don't have any type of coverage. Underinsured, meaning they're on some sort of public assistance program. So Minnesota Care, like Dr. Ripley mentioned, or medical assistance. And so we have, that population. We do have an income level, but there's also those families that are in that gap. So perhaps they just lost their coverage, they're switching a job, uninsured, or for whatever reason, they cannot access the general health care systems. It might be that they have a big debt, and now that clinic has closed its doors and they're no longer able to see their primary care. And so that's another gap I think that we see while we work with that patient to be able to help them get back into their normal routine provider that they see every day. So those would be the folks that we would serve.
Basically anybody without private insurance with some sections. It's generally a low income slice of folks. We see people though, we really try to be that access point and front door, and it's why we build collaborations with CAC, Northfield Hospital, and others, that people come to us when they're having a crisis. And maybe they technically could get coverage or have coverage, but just there's millions of ways people aren't able to get seen, as I'm sure we're all sadly familiar with. We can see them, get them stable, and then do a really warm handoff to a primary care provider at Alina or something like that. So hopefully that answered your question.
We know that chronic stress has bad impacts on people's health, including systemic racism. So I wonder if you've noticed changes in the mental and physical health of the people you take care of based on the hostility that's coming from the federal government now.
Absolutely, yeah. We've seen an increase. I mean, right now our mental health therapists in the schools has a wait list. We have a wait list that's going on because parents are struggling with their youth. Their youth are struggling and knowing, are my parents going to get picked up today? Or just having that concept and having to live with that every day, it's really tough to see. A lot of the families who thought, we're leaving a country of turmoil and just, a lot going on in their trajectory to get here. They get here and now they're, constantly facing this hostility in the news of being kicked out. And so we see that a lot. We've definitely seen an increase in our services for mental health. And not only that, but I mean, Dr. Ripley could probably speak on this every day, where they have to spend extra time, with their patients just to, be able to give them, I think, some hope that everything will be okay and that they still have us, there for them to be able to meet the need. But it's very real. We see it every day.
I talked to Lee, our treatment person, and our recovery staff that do the kind of open-ended recovery support groups with youth, and they just say, this is a big driver to unhealthy behaviors and ongoing stress. That is hard on, frankly, all of us.
I can say that as for me as a provider, patients, I mean, I am clearly not a part of the community with my patient population. That's pretty obvious. I don't speak their language, although I'm working on that. The various medical problems they're having and how many of those are directly related to stress, mental health complications of those worries and stress and lack of sleep and all those things. And so they come to me and I'm hearing them say this, and often, of course, they're not actually really telling me that some of what the problem is the stress related to what's going on around, the fear of what could happen to my family member if they leave their house. I mean, sometimes it might not be the patient that's worried about leaving the house because they aren't afraid of, they maybe have legal status, but they have a family member that just doesn't want to leave the house. And often when I just give them a little bit longer, like, let's talk about why aren't you sleeping? What's going on? All these labs look fine. And then suddenly the eye is teary and that stress is coming out more. I mean, I would say some of those stressors for our population have always been there. They're people living with kind of on the edge of having enough resources for day-to-day life. But I think during this past little bit of time, we see that more and more. And actually just providing the opportunity for those people to be able to come and talk about that safely, I think is therapeutic in and of itself because they know they can come to us. And sometimes for me, I have to be a little bit more intentional about making sure they know that that's okay to tell me about that too.
A few weeks ago, someone came from Healthy Community Initiative and gave a nice presentation about the important work that they do. Do you coordinate with that organization on some of what you do?
Yeah, they do a lot of the kind of systems level, as you heard, bringing agencies together. And so one of many coalitions that they help provide the backbone for is the Overdose Response Council. So they bring together law enforcement, county services, county attorney, and other human service agencies and figure out how we can work together to reduce overdose deaths. And we've been quite successful in that work. And so we work together with them very closely on that, as well as other, the Family Services Collaborative. We're kind of a participating agency with them.
I probably don't need the mic, but I'll try it. I still would like to know a little bit more about your funding. I did not know that you have patients that have Medicaid, so I'm sure you're getting some reimbursement from that. And you might have patients that are, I don't know if you have patients that are underinsured or they can't pay, they couldn't pay the bill if they had to go to another doctor. But I'm curious what other kind of funding you have. I know that you've had, what do you call it? Kind of like a fundraising gala for quite a few years that I've been at. So I'm just wondering, you know, how do you pay the bills?
No, it's a great question, and I think it's another way that we've really been strategically building some resilience for this moment, without knowing this was the moment we'd be facing. But we've been working hard to really diversify where our dollars come from, and I think are starting to see some of the results of that work. We have about 4 equally balanced buckets. One is we have dozens of volunteers, and the health systems donate quite a bit of diagnostic imaging, MRIs, X-rays, those kinds of things. We get then about 25% from earned income, so that's we have a sliding fee scale for patients that are uninsured, which is most of our patients. For some of the patients that have insurance, we can bill public assistance for, and so that makes up about 25%. 25% then are grants and foundations, so folks like Delta Dental, the State Department of Health, DHS provides grants that are quite competitive, but I think their funding is a testament to the truly innovative things that we are doing. And then that last piece is, as you said, from the community. We need to raise about $1.5 million from the community, our annual fund. We have an annual fundraiser each year, but you know that 1.5 is turned into essentially 4, you know, through those other sources. And so I think we're feeling more resilient in that we're more balanced across those areas. But if you know Medicaid goes away, there's less earned income. We are more prepared than we have been in the past to take up the slack in the other buckets. But that's roughly how we do it.
Any other questions out there? Because I have a few questions. Speaking of where our income comes from, I feel like on the medical side, we probably have less public assistance type things. I mean, some of our dental patients, especially, probably have it, and some of our substance use disorder patients will have some form of public insurance. On the medical side, if you have MA as a doctor, I'm like thrilled because I can get those folks some of the things that we just absolutely can't get for them through us at HealthFinders due to whatever. We don't have any specialists. We have myself and Emily Carroll, who's a nurse practitioner. Between the two of us, we have a 1.0 FTE of patient care, and the rest of our providers are volunteers from the community. That are nurse practitioners and a few doctors, or retired folks that decide they weren't going to give to us that way. Some folks that are still working and they come to us on their day off from their regular job to volunteer. So on the back of that, I want to just ask the question that one of the things that we get asked a lot is, what can you guys do, what can be done by the community to help support the work of what we do at HealthFinders. And I will pass that off to Charlie and Daisy to answer that one.
Well, one thing is volunteering, not just our clinical professions, but if you have human resource knowledge, custodial, finance, I know Daisy's working on a handyman for our Faribault building, 30 years old. But there's lots of ways to get involved as a volunteer. I would love for all of you guys to sign up to our newsletter and maybe just sign up tonight. Go to healthfindersmn.org/contact. Just fill out that contact form and say, hey, I saw your team at the event at St. John's. We'd love to hear from you and talk to you more about ways that you might want to get involved. As I said, our finance gap, we are always looking for folks to donate. If you look at the 1.5 we need to raise, 1.5 million we need to raise, spread that across 5,000 patients that we see, that's $300 per patient each year. And another way to look at it is that we need 5,000 folks in our community to donate $300. And then that can ensure that nobody goes without care, that our innovative model is helping not just our patients, but we're helping Northfield Hospital serve their patients better. They're not incurring additional costs through inappropriate emergency room visits or written off inpatient care. So $300, tell 4,999 of your friends. And we're also, as I said, this learning about what makes folks healthy is such a part of our model that we can elevate for folks that don't necessarily know. We can advance our model. We can bring this to grant applications. And so we're launching this new initiative next month called Health Circles that really are about bringing people together and talking about health. And, it's not just learning, but really the power of coming together with your neighbors to talk about what makes you healthy is an act of self-care and health in itself. And so we're going to encourage folks to get involved in that. And so look for that. So that you can see that, please sign up to follow our newsletter. We send it out about once a month. It's always very short and relevant, I promise. And won't be pushed to your junk mail. But we'd love to see you at least as a part of that.
I was just asked the question of what can we do by another church in town that was doing some social justice studying, and the one thing I think I want to add to this group and to others in our community that may not actually be actively involved in the community of folks that we serve at HealthFinders, I think one thing we can all do, if you don't have a skill to volunteer at speaking Spanish in the clinic and helping those of us who don't speak Spanish very well, or if you have skills as a healthcare person of some kind that you could give to us. But I think the one thing we can all do is we can help the people in our community that are more vulnerable. We can help get to know them as part of our community. A lot of us don't have a lot of interaction with that part of the community. A few weeks ago, when George Zuccolotto and Christy were here talking about the community of Viking Terrace, there's so many of us that live here in Northfield and maybe don't ever have any action or interaction with that part of our community. These folks that we have the absolute pleasure of being able to help care for are a part of our community here in Northfield, in Faribault, in this county. And they have so much to bring when you have the opportunity to get to hear their stories about how they came to be here. And so I'd encourage you, if you don't feel like you can give in any other way, try in some way to just have these folks become a part of what your community is here in Northfield and Faribault and the rest of our county. So thanks so much for all coming to hear about what we do at HealthFinders, and please feel free to ask questions and come learn more about us if you would like to have interest.
Thank you.
Thank you so much. You've given us a lot to think about, and we so appreciate what you do for our community. Before we leave tonight, I hope you will help yourself to some more goodies and coffee. And I'd like to also share, this is the last of our fall series for Courageous Conversations, so we won't be back again until February. But I'd like to share our 3 programs that are scheduled for the spring. In February 5th, we will have Amna Khalid, who is a professor of history at Carleton College, who will share her insights and expertise on issues related to censorship and free expression. And in March, we'll have Lupita McClanahan, who is a Navajo elder from Arizona's Canyon de Chelly, who will speak on surviving Indian boarding school and nurturing personal resilience and strengthening cultural identity through adversity. And then we just learned we have a name and a person for April, Ibtisam Al-Adiyat, who is a Palestinian Jordanian scholar, teaches sociology at St. Olaf College, will be speaking on bearing witness to inequities. So please come back in the spring, and thank you all for being here, and thank you again to Charlie and and Daisy and Amy. Sorry, I'm terrible with names. So another hand. Thank you.